Will Proposition 52 result in continuing federal funding of California Medi-Cal medical care?
Let's talk about that.
Thanks for joining me, Dr. Mark Vaughan of the Auburn Medical Group, for my comments about Proposition 52. Proposition 52 provides for continuing a fee that is charged to hospitals. These hospitals are charged the fee by the state. This money is then used to help pay for Medi-Cal treatment for patients who are low income in the state of California. It is then matched by federal funds. So somehow our state gets eligible for federal matching funds from Medi-Cal because of the state's paying this fee. So the hospitals are actually, for the most part, glad to pay this. And in fact, hospitals are promoting Proposition 52. They want you to vote for it so that they can pay these fees because they get around twice as much money from the federal government to go into their Medi-Cal programs. Now, this fee program currently will end in 2018. The state legislature started it back in 2009 and has continued it 3 or 4 times since then to continue charging this fee. The reason that the hospitals now want us to vote as voters to keep this a permanent fee that they get charged is because there's some other details that come along with it. And that is, it makes it very difficult for the legislature to get their hands on this roughly $3 billion. So you can see how the hospitals would want to have kind of a permanent fix to getting a return on these fees that they're charged. There are people who oppose it, and their opposition is pretty much boiled down to there have been some abuses by hospital administrators in the past, misusing hospital funds. So by not having the legislature have easy access to control where this money goes, it could get abused. That's the argument against it. It's individuals, 3 individuals, one was a nurse practitioner, who wrote their arguments against it and rebuttable for the arguments for this proposal in the California Voters Information Guide. It looks to me like it's something that would probably be okay if it wasn't voted in place, but the hospitals would really like to have that money guaranteed since that's what it's supposed to be going towards. So I understand they're wanting to have a voter initiative. I also understand why this probably wasn't done by the legislature, because it would be taking their control away, requiring a 2/3 vote for them to be able to do anything with these fees. So keep that in mind as you vote for Proposition 52. Also, to see all of the other propositions, once we get all of them done, they will be posted over on this side of the screen with a little icon up there. It's a little eye, and you click on that to watch for some. Thanks again.